Hello, dosto. Today we have come up on another interesting episode of podcast. Today our topic is such that every one of you might be interested. Our very own teeth. Yes, today we're going to talk about dental health, and for this we have on our show Dr. Arpita Datta, dental surgeon specialized in pediatric dentistry. Welcome Arpita to our show.
Thank you, Molivi.
Yes, Arpita, as you're a dental surgeon, so we'd like to know from you why dental health is important. I know it's a not common topic that's talked about, and it's very important for our overall health. I would like to listen the answer from you.
Yeah, surely. Thank you for inviting me over for this podcast.
Oh.
And okay, so why is oral health important? I would rather like to ask, why our health is important. If our health is important, then I think the first and foremost thing is the oral cavity. Okay,
Right?
the mouth.
Yes, you are right.
So we can say that health. We can say the health is shown with our mouth. If our mouth is healthy, then our overall health will be healthy. Okay, our overall body will be healthy. We can say in that sense.
Yeah.
So taking care of the oral health or the oral tissues. This include all the tissues like teeth, tongue, the whole buccal cavity, and everything. Okay, it should be taken care of.
Doc, as you have said, like oral health is so much important, and apart from its aesthetic value, like we know having white teeth look giving a charming smile and all that, apart from this beautification value, could you just attribute some of the scientific perspective why dental health is important and how it's contribute to like some important activities like digestion and even in like pregnancy or in motherhood journey, how it impacts the baby's health? Could you just highlight on this?
Right, very rightly said that oral cavity, it connects with various other health issues. For example, if I start with gestational health, okay, in gestation we have seen because of various hormonal upsurge, it contributes to various gingival issues. Okay. And gingival issues, by this I mean various pulp polyps or something like that, and these issues can be transferred to the baby. Okay.
Wow, this is a fact we didn't know.
Yeah.
Like listening from the doc, you must take care of your oral health now. Okay, moms?
Yeah.
Now,
so all the mothers and all the upcoming mothers and fathers too, they should take care of their oral health. So there is a term called the perinatal health. Perinatal health means 20th to 28th month of the gestation to about 1 month after birth of the baby is called the perinatal oral health. So in these full period, we have to address various oral health issues regarding like dental decay, like various gingival inflammation, and all of these things have to be taken care of, because there is a very good saying that prevention is better than cure. Okay.
Right.
So we are also reading about such things like genetics play a very important role in transmission of dental caries. There is a bacteria called the Streptococcus mutans, which is the actual we can say the villain in dental caries. So if the level of dental Streptococcus mutans is more in the saliva of mothers, it gets transmitted to the baby in the infants.
So they might be prone more to the dental health problems.
Yeah. And there is also your vertical transmission directly from the mother to the baby. This can happen by sharing utensils like spoons, or sometimes the mothers in order to check the temperature of the milk they are giving to the baby, sometimes they lick. So
they taste the milk,
So we tell them to not do this, to discontinue such things, and using sharing utensils should not be done. This is your vertical transmission, and there is something other called the horizontal transmission, where the transmission of salivary bacteria can happen from the paternal side and also from other friends,
relatives, anyone residing in the home.
Those things can happen.
So guys, dental health is very important, especially to be taken care during the pregnancy trimesters. Yeah, as mentioned by doctor. Okay, with this I would like to ask you, are oral health has some connection with other important diseases like cancer? I should say the most. dangerous one, and cardiovascular diseases and other. Is there any linked study?
Yes, ma'am. It does have a connection. Like we have read various articles which mention that the underlying dental caries and the underlying gingival issues, if they are not taken care of, can lead to various cardiovascular issues, and they can also lead to pneumonia and various other cancers as well. And we very well know about oral cancer. Oral cancer is
oral
also
cancer.
It's a great threat to the whole nation.
Right. It has also an economic impact on the person suffering from it.
It does.
Yeah, it's better we should take some steps towards.
Yes.
Yeah. With this, could you bust some myths, common myths, and some of the misnomers that generally prevalent in our society about our dental health?
Yeah, ma'am. Actually, in my day-to-day practice, most of the parents, they are very much neglecting towards the oral health of the child. See, they generally have a notion that milk teeth will fall off, so we don't need to take care of them. But this is a total wrong notion, I must say this, because milk teeth, they help in the overall development of the child, overall psychological development, because we know peer pressure is a great thing nowadays. And in this era of social media, we are very much conscious about our, you can say, our
appearance and everything.
Yes. And apart from that, it also helps, the milk teeth also helps in maintaining space for the successive teeth, for the permanent teeth. And apart from that, they also help in mastication of the child, mastication of food.
That means
chewing of food.
Okay, chewing of food. Okay, okay.
So in such way, the teeth are very much important. So the parents should also be careful about the milk teeth. Secondly, they feel brushing vigorously and brushing like very much hardly will clean the teeth surface, but it's a great no.
Oh wow!
Because
you won't believe, I know a same person who does the mistake. Thanks to you, ma'am. Like, it's a mind-boggling information I have got.
Yeah. Because it leads to tooth material loss, and in due run, it leads to sensitivity of teeth. Apart from that, I have seen people who come to my clinic. You say, like they tell, if we get our teeth extracted, it might lead to blindness. So it's a it's a great myth. And one thing you'll be very much surprised to know. Like, can you tell why milk teeth are called milk teeth?
I was thinking the same to ask you why this is called milk teeth. Like,
okay, fine. People think that milk teeth are the teeth which come first because these are like doodh ka daat. So because the baby is on milk. No. Apart from that, it is called milk teeth because the refractive index, like the light, how it's reflected from the teeth, it's similar to milk. So it's known as the milk teeth.
Wow, how interesting. Milk teeth is called milk teeth because its refractive index is similar to milk.
Yes.
Wow. With this, we have come up on the most important part. How is the timeline? Like, when teething occurs, what is the first eruption timeline? Could you just explain? And also, like, types of teeth and along with the functions.
Yeah, for this, see, I have teeth carving. So here we can see these are the permanent teeth and these are the primary or milk teeth. Okay. So starting with the milk teeth, the first ones to erupt are the incisors. Central incisor, then comes the lateral incisor. After that, we have the canine. These are those sharp teeth. These are the upper jaw teeth. These are the lower jaw teeth. This is the milk teeth and these are the permanent teeth. So these are the central incisor, lateral incisor. This is the canine. This is the first molar, maxillary deciduous first molar. This is the second molar. And subsequently, this is the lower jaw incisors, canine and molars. And coming to the permanent teeth, these are the incisors. 4 incisors, then 2 canines, then 4 premolars, and then 4 molars. Here the wisdom teeth has not been kept.
Okay.
Okay. So wisdom teeth is also, we can say it's a myth. People say that when wisdom teeth is extracted, the wisdom will also go off. No, nothing like that happens.
There is no link to wisdom.
Yes. So the incisors are used for biting and the canines are used for tearing and the molars in deciduous teeth, and the premolars and the molars in permanent teeth are used for chewing purpose.
Whole chewing and making into a bolus type.
Yeah, this is the type of the teeth and their functions. Now coming to the eruption.
Yeah.
Okay. So coming to the deciduous teeth. I'm telling it as a vague way because the timing of the teeth eruption are not same for everyone, but we can say like around 8 months to 10 months the incisors erupt in a baby, and by the age of 2.5 to 3 years all the teeth, the milk teeth erupt in the oral cavity. Okay. And by 6th year of the child's age, the permanent incisors and the permanent first molar comes in the oral cavity. Oral cavity.
Okay.
Like just behind the deciduous second molars. So many of the parents are very much confused about this fact that they actually confuse the permanent first molar with deciduous teeth. So they think in case of a carious tooth that it might also follow, but it is not the case.
It is not the case.
It is not the case. And in permanent teeth, by the year of 6 to 7 years to 8 years, the incisors come. By 9 to 13 years, the canines come. The premolars come by around 10 to 11 years or 12 years, and then the second molar and third molar, they come by around the second permanent second molar, it comes by around 13 to 14 years, and then the wisdom teeth comes by around 17 to 21 years, and in some cases even up to 25 years.
Later stages of life.
In the later stages of life. Now here I want to make it a point, ma'am, that the wisdom teeth, with due course of evolution, the jaw space is not that much. In some cases the wisdom teeth cannot erupt.
Yeah,
but
due to lack of space.
Due to lack of space, but it in the course of eruption it might create some swelling of the gums.
Yeah, I too had this wisdom teeth and it has caused me lots of pain and inflammation and swelling. My God.
Yeah, and also give rise to problems like food lodgement in that area. So in such cases we have to prescribe them with antibacterials and all. And in that case, if the teeth has not erupted, we have to go for surgical extraction. Yeah.
Right. With this, the most important part that every parent should want to know, how to take care of the oral hygiene of their kids before and after, what should be done.
Okay, ma'am. People, they don't understand about the importance of toothbrushing or importance of keeping the oral cavity clean. I must say, many of the parents, they come to my clinic or my practice and they say that the child got carious tooth just at the beginning only, like with the eruption only the teeth was carious. This happens because a bacterial biofilm or bacterial layer can be found over the gums before eruption. So in that case, the gums and the tongue has to be cleaned. Of an infant has to be cleaned with a gauze piece. The clean gauze piece can be wrapped around the index finger of a caregiver, and they have to carefully and softly clean all the gums and the tongue area. It has to be clean, and this honey should not be used for cleaning. In some rural places, I have seen people using honey. It should not be clean because it is cariogenic. And so this is before eruption of the teeth.
Yeah, before eruption, and it should be done ideally once a day.
As and when you see like if there is any residue in the gum, because child cannot swish their mouth, they cannot clean their mouth, so it is the duty of the mother or the caregiver. In case when the teeth erupts, after the teeth erupt, for example 1 or 2 teeth has erupted, in that case people should start toothbrushing.
So doctor, as we're talking about like how parents should take care of the kids' dental hygiene, so could you give us a tips how to do the brushing?
Yeah, ma'am. Like after the first tooth erupts in the oral cavity, we should take a smear of the toothpaste. Just a slight smear, up to 2 years of age. And the smear should be taken, and it should be used in a circular fashion, just like this. A circular way, small round circles. First the child has to be demonstrated for making big circles, then after that smaller circles, and then when the child gets accustomed with the smaller circles, we have to make them to the brushing. And supervised toothbrushing should be done in all the areas along with these inner areas. Okay, this is for a 2-year-old kid. When the child goes to around 6 years or 3 years,
Okay.
pea-sized toothpaste should be
Pea-sized
used.
stick.
Yeah,
Okay.
can be used.
Small
and
मटर के दाने जैसे छोटा
हाँ,
सा थोड़ा सा
छोटा
लेके
सा,
then
हाँ.
same process.
Yeah.
Small round circles from back to front and then back, and
Yeah.
also inner part and upper
Yeah.
jaw.
After that, in my view, the child should be supervised up to the age of 7 years to 8 years during toothbrushing. Now, how can we make toothbrushing a fun fact?
Yeah, they'd
We can
like to know.
we can make a timetable, like a regular routine of doing toothbrushing. Both the parent and the kid can stand in front of the mirror and they can dance to their favorite song, or they
Wow.
can hear to their favorite song and do toothbrushing. The child can be rewarded for doing maintaining their oral hygiene, and various toothbrushes have come in the market.
Cute sized one, na?
Yes,
I miss we didn't get so much of
yeah,
cute
we did
fancy
not get
toothbrushes.
those brushes,
Yeah.
right? So various musical toothbrushes do come in the market. Apart from that, I must say, apart from these manual toothbrushes, there are power toothbrushes, reusable power toothbrushes. They can be used for people, for children who are special kids, or
Okay, yeah.
or who are like medically or like physically challenged, can be used, or for kids who are not accustomed to doing this manual toothbrushing can be used. And also, apart from that, we have various silicone based chewable toothbrushes.
Okay.
The brushes can be kept in the mouth
And then chew.
yeah, by chewing they activate the bristles and they can be used.
Wow.
Apart from that, there are various
New
like
techniques
plethora.
like coming up.
Yeah, like a plethora of toothbrushes, like solar powered, infrared powered, laser powered, this, that.
Wow.
Lot of them. So in this way, the brushing can be made a fun like
activity
game.
for
Yeah,
the kid.
for the kids.
Yes, and this will also help in prevention of one of the disease I know, that is dental caries.
Yeah.
So with this, I'd like to ask you, what are the typical signs and symptoms a parent or a caregiver could observe in the child, maybe in the early stage or in the later stage, that could indicate some of the dental caries or any other dental problems, you say?
Yeah, ma'am, it's a very good question.
Thank you.
Firstly, when the child starts having dental caries, the first and foremost sign that has to be seen are your white spot lesions.
Okay.
White spot lesions are they are generally placed here in the
gum area.
Yeah, in the gum area.
Okay.
And with due course of time, they will turn slight brownish. And apart from that, it can also produce slight cavitations, and then it might represent as sensitivity with gum swelling and so on, pain and all.
Pain also, no? We can
Yes.
find pain also, but
Yes.
I think pain might be the latest stage where
Yeah, it must be
it has
the latest.
progressed
And
so much.
one thing I should mention here is that a teeth has two layers in the crown portion. The portion which is seen in the oral cavity, this portion, crown area, it has got two layers. One is the outer enamel and the inner dentin. When the enamel is exposed because of this demineralization or caries, when the dentinal portion is exposed to the oral cavity, it leads to sensitivity.
I think we could see that this is the crown part.
This is the crown
ताज
portion,
की
ma'am.
तरह बैठा है.
And this is the root.
Root. Okay.
And in the longitudinal section, this brownish part is the pulp of the tooth. It has got all the nerves and blood vessels and other cells
Which give
which
nutrition.
gives nutrition to the tooth. Apart from toothbrushing, ma'am, the various areas which are present in between the teeth, they cannot be cleaned with normal brushing. In that case, we have to use floss.
Floss. Oh, dental floss.
Dental floss for cleaning these areas.
Like सौ की तरह काट
Yeah. Just like that. These are flossers. This floss can also come like strings, take around 14 to 24 inches. And for a child, just tie the two ends make a loop. This is called the loop method, in which the string can be used and they can be held in this thumb and the index finger, and the extra material has to be wrapped around this ring finger.
Yeah,
ring finger, and then use this 2 fingers to engage the floss in between the teeth
for the children. The
for
parents
the children,
will assist
and also for also the adults. For children, I am telling you the loop method, in which we tie the 2 ends. That can be used for flossing. Apart from that, mouthwashes can also be used. For children, we have got various fluoride mouth washes, and the fluoride content of the toothpaste in child should be around 1500 to 1000 ppm parts per million.
Okay. And all these dental care accessories would be found in medical stores nearby.
Oh yeah, very
easily. So people should readily use it and get the most benefit out of it.
In case, ma'am, everything is available online nowadays. People can also
and in case you don't find it, please consult ma'am. She will guide you how to do and all this. Okay, so with this, what are the could you say any, as you've described, what are the preventive measures and everything? What are your view on the role of diet in dental hygiene?
Oh ma'am, it plays a huge role, ma'am. See, this demineralization or dental caries happens because of cariogenic diet, like sticky food, and the bacteria, oral bacteria, which is present normally in our oral cavity. And these 2 things, and apart from that, the flow of saliva. We all know that when we sleep at night, the salivary flow reduces. So, in case the child is on breast milk or on any bottle formula, if the child has gone to bed without getting their teeth cleaned or without getting their gums cleaned, with due course of time, it will produce a biofilm, a bacterial biofilm, and which will give rise to dental plaque, and hence it will go towards dental caries. So what should be the ideal diet? See, ma'am, first of all, we should know about all the no that we should not be given to a child.
All the things to avoid.
Sugar should not be given to a child aged 2 years. It should be introduced in their diet after that. And even in a child 3 years of age, the amount of fruit juices should not exceed around 120 to 140 ml. It should not exceed after that. And in between snacking, like all sticky food like chips and your dry fruit, something like that, which stick to the tooth surface, should not be given. And in case the child is adamant, he or she wants to have chocolate, something like that, then straight away brush the teeth, or make them brush the teeth, and the parents should be present with them when they are brushing their teeth in front of the mirror.
And it should ensure that they are doing in the right way, just like you described it.
And also another thing is that swishing your mouth with water is very important. It's very important. Post meal, then post tooth brushing, how it has to be, and all the extra toothpaste should never ever be ingested, because extra amount of fluoride can give rise to various other health issues like fluorosis, something like it does. Fluorosis is one of them. So extra amount of toothpaste should always be spit out.
Okay, wow. This, because I've seen many people around me, after doing just one amount of squishing, they just go randomly to their work or maybe anything. They're in a hurry and they gulp all the things.
Yeah, ideally the swishing has to be done till the time the water that we are spitting is crystal clear.
Oh wow.
Even if it's milky white, we should continue. I mean, ideally we should at least do 3 to 4
rounds of squishing.
That is
with this, I have could relate. In Ayurveda, we have oil gandusha, that is called oil pulling. Nowadays, most popular, like many celebrities are doing so. That has also similar benefit in oral hygiene.
Ma'am. Actually, I have also gone through various articles in which they have mentioned about various oil pulling methods, and but one thing I want to mention here is your American Dental Association. They do not promote this oil pulling. But having said that, there are various articles which have mentioned about the various important aspects of, or the important effects of oil pulling. See, using mouthwash is very much important, but overusing mouthwash for a prolonged period of time can give rise to staining of teeth. But oil pulling will not be doing the same. So in case if there is a place where people cannot afford your mouthwashes.
Costly mouthwashes.
Yeah, they can use various readily available oils like
Which are
coconut
pure
oil.
and organic.
Mhm.
Yeah,
Can be used.
can be
But
used.
along with toothbrushing and flossing.
Yeah,
I
right,
must say.
right. Nothing is
And
like they're
yes.
complementary therapies. Nothing has to be think about a substitute.
Yeah, but children lower 5 years of age should not be
Yeah,
using
should not
oil
be
pulling
doing
because they
oil pulling.
might ingest.
They might ingest it and may cause
Hmm.
harm. Yeah,
Yeah.
right. With this, how do you give the final piece of advice to our listeners? Maybe the parents, maybe the aspiring parents, as you've rightly mentioned, that prenatal care is also important
Mhm.
in because we've seen case studies like low birth weight and something
Yes,
related
yes,
to
yes,
oral dental, poor dental hygiene.
Hmm.
So, how could you address all these issues and also give some advice and tips to the all the generations that lies ahead?
Ma'am, like when a parent is aspiring to become a parent,
Parent.
they should get themselves checked, their
Checked.
oral health checked. And one thing is that we all know that a child is a replica of the adult. So
Right.
in many cases, I have seen that a child has a very you can say advanced way of feeling and viewing the society on their own. So in that way, we can the parents, I as a parent can or should rather like present a very much important role in front of them. We should take care of our oral health nicely so that they are in turn the kids are also like they are
Like we should walk the talk, not just only giving lectures,
Yes.
and we should do it practically so that they could follow us and learn from us.
learn from us.
Yes, right, right. I would also like to ask you one fact that every people, like maybe I should say kids and their parents, are frightened so much when they heard the name of dental surgeon, right? But they are going through some problems, but they don't want to visit. So, would you explain our listeners how a parent should prepare his or her kid for his first dental visit?
Okay, ma'am, another interesting question.
Yes.
So when it comes to my patients, I get very much overwhelmed. So because I love
Yeah, you love kids, yeah.
the kids. So first and foremost thing the parents should keep in their mind is that don't make it a point, like don't make this dental visit as a thing like a punishment for the kid. Don't keep saying things like if you are doing such naughty things, then the doctor will give you an injection, this or that. So this creates a lot of white coat anxiety in the kids.
Yeah, right, right.
So when a parent is preparing his or her kid for the first dental visit, they might incorporate something like some videos which reinforce the importance of oral health, keeping the teeth clean, and also they can show them pictures of dental surgeons or about the oral operatory, and they might also show them or show the toothbrushing or the various things which are done in the oral cavity in their favorite toys. Their toys can be used as a prop to
Make this interesting, more engaging. Yeah.
And in our part, we can keep a very friendly rapport with kids. We have to come up to their psychological level to understand their problems, so that they become very much friendly with us, and they help us in doing the treatment. The child also helps us, and we also do have various play areas in our operatories where the children can ease off their anxiety, and the first dental visit should never ever be used for dental treatments. That should be properly for diagnosis and letting the child understand the dental operatory and the doctor.
Yes.
Okay. These things can be taken
being
care
in
of.
some tough good relationship with the doctor, and then slowly as the visit progresses.
Like me as a dental surgeon, I have seen various patients where in the first dental visit they were very cranky, but with subsequent visits they have become one of the most best
cooperative patients. Yes. How nice. So with this, parents should keep in mind not to build any such kind of apprehensions that could create fear or some kind of stigma regarding surgeons or as well as dental hygiene. Okay, there should be easy to talk, friendly atmosphere even between the parents and kids.
One very important query which I get from parents are that, ma'am, we can bring our kids, but will they sit in your dental chair? Will you be
Yes.
able to do the dental treatment? See, we have used various behavior management techniques, like tell, show, do, this and that. We might like arrange for the dental visit of a child in such a way that a cooperative child is undergoing his or her treatment, and the child can see that patient. In that way, they can understand how the treatment goes through. And apart from that, we can use various AI driven models like virtual reality things and all, in which the child can get distracted, and in the same time we can do their treatment.
Yeah, you can do all
Apart
the
from
tasks.
apart from that, we also have like various sedation units in which the child can get sedated, and in that time we can complete our treatment.
Thank you so much. And with this, prevention is better than cure. So before your dental health become worse, प्लीज 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 दोस्तों अपना दांतों का ध्यान रखिए, टाइमली डॉक्टर विजिट करिए और हमेशा हंसते मुस्कुराते रहिए। हरिओम।